Hello Shalini, how are you?
Fine, I'm super. Thank you, Suman.
Excellent. And I know today was a very amazing day. We were all at second session at World Health Organization (WHO), and you were there. And I know you had some amazing insights from talking to people there. So we'd like to know your experiences of course, the session itself and your interactions with some of these eminent scientists and doctors and some top executives at WHO who were there at the session.
First of all, let me congratulate you and Amma for having a fantastic session. You were there only for an hour, but then that was like it got condensed into a form of a capsule, and it was given at the right moment to the right people. So it was fantastic. So congratulations on that first. Because your presentation was great, a lot of questions got stirred there and a lot of emotions got stirred. So while I was standing there, a lot of people who knew that I was a doctor and I'm also a student of Amma, they came up and they were asking. So I was asking them how their experience was, how they felt. And of course, each one of them, they felt the difference. They felt this immense calmness, positiveness, happiness. So those are those basic, very basic emotions, but most important emotions that they felt within a period or a span of an hour of not even meditation of an hour, but talks and everything. So few of them they were a bit skeptical, also because they're technocrats, they're scientists, and they wanted to know. Because it's very simple, how was it that is it very effective? They were wanting to ask me, and they were wanting to know, is it evidence-based, and there was a research done, and this and that. And I just felt, I just stopped. I told them, I said, well, there are almost like, there may be 8,000, 9,000, 10,000 research work studies already done by a lot of eminent institutions and all, and we all know that as medical professionals, and we know that. But are those studies, those immense deep studies, have it ever helped us in any ways except that we read them and we read one research, we read another, and we see the result, we see the methodology, and that's about it. It never touched us. It touched us here probably because it comes to us as a piece of information, and we just mark a tally mark that okay, this is 1, this is 2, this is 3, evidence-based, yes. But then does it ever help us? Has it ever helped us in any ways? No. And I just felt like telling them that, and I did tell them that those were complex researches which involved a lot of money, a lot of time, but that was not that complex. The complexity which I am absolutely awed is what Amma is teaching us, because imagine that complex material. It is complex definitely, and how she has simplified it so much and broke down into 2, 3, 4 absolutely simple basic steps. For example, to smile, to breathe. And for me, that is the most complex thing. And of course, the people over there agreed, because I just asked them, I said, I was looking at so many people when we were breathing out, and most of us, we did not know how to actually breathe through our noses. So I said, well, isn't it strange that we're sitting in World Health Organization, this is the biggest organization of health in the world, and we ourselves, the technocrats and scientists, we are not able to synchronize our breathing. For me, that was really strange. And of course they agreed, because that's how they felt. But they felt super, and they felt rejuvenated, and they all of them felt that yes, it is so doable. Just smile a little bit, bring yourself to the center, and just love yourself. It is so simple, it is so easy. Yet, if you if you dive deep into it, it's just tip of an iceberg. So that was my experience for today.
In fact, what you said is absolutely wonderful. In fact, Sunita always talks about it. There is a lot of information out there in the world, but information is not enough. What happens in Sookshma is transformation.
Absolutely.
And that transformation is so simple and subtle, like you said. And that transformation creates inspiration.
Yes.
Because when people see you or me or others as a transformed person, they will be like, wow, if that person can transform, I want to transform too.
Absolutely.
I want to transform too.
Yes.
So that's the beauty of transformation and inspiration.
Absolutely. In fact, one of the student who came recently to Amma, she looked at me, she says, wow, if you can do it, I can do it too, which is fantastic.
Yes.
This is what, this is it. I mean, everybody can do it. It's simple, but a simple dedication is required. But even with the dedication, it may seem like you're putting in effort initially, but then after a period of time, it becomes your habit. And habit is effortless, I feel. So I want to make it in my habit. I've always started doing it and feeling tremendously proud of myself and loving myself more than ever. So yes, thank you.
Thank you very much, Shalini, and we'll connect back with other experiences of you and realizations very shortly. And hopefully we'll be back at WHO again to inspire the global leaders in health.
I'm absolutely sure about it. Thank you. Thank you.